Question 1. A nurse is caring for a client admitted with acute myocardial infarction. The client suddenly reports chest pain, shortness of breath, and diaphoresis. What is the nurse's priority action? A. Administer morphine. B. Apply oxygen. C. Obtain ECG. D. Call the healthcare provider. Correct answer. B. Apply oxygen. Rationale. Airway and breathing come first using ABC priority. Oxygen helps improve oxygenation to the heart muscle and reduces ischemia. Strategy. Use ABC rule. Airway. Breathing. Circulation. Breathing problem equals oxygen first. Question 2. A client with head injury becomes restless and confused. What is the nurse's priority action? A. Reorient the client. B. Assess oxygen saturation. C. Give sedative. D. Call family member. Correct answer. B. Assess oxygen saturation. Rationale. Restlessness is an early sign of hypoxia. The nurse must assess oxygenation immediately. Strategy. Early signs of hypoxia. Restlessness. Anxiety, confusion. Always assess oxygen first. Question 3. A nurse is caring for a client with hyperkalemia. Which finding requires immediate intervention? A. Muscle weakness. B. Peaked T waves. C. Nausea. D. Diarrhea. Correct answer. B. Peaked T waves. Rationale. Peaked T waves indicate life-threatening cardiac arrhythmia. Strategy. Electrolyte plus heart equals priority. Always treat cardiac changes first. Question 4. A client with diabetes becomes diaphoretic and confused. What is the nurse's priority action? A. Check blood glucose. B. Give insulin. C. Call provider. D. Give water. Correct answer. A. Check blood glucose. Rationale. Symptoms suggest hypoglycemia. Confirm blood glucose before treatment. Strategy. Don't assume, assess first. Question 5. A postoperative client suddenly develops shortness of breath and chest pain. What is the nurse's priority action? A. Elevate legs. B. Apply oxygen. C. Call provider. D. Administer pain medication. Correct answer. B. Apply oxygen. Rationale. Possible pulmonary embolism. Oxygen is the first priority. Strategy. Sudden SOB equals oxygen first. Question 6. A nurse is caring for a client with sepsis. The client's blood pressure drops to 86/50 mmHg. What is the nurse's priority action? A. Administer antibiotics. B. Increase 4 fluids. C. Check temperature. D. Call provider. Correct answer. B. Increase 4 fluids. Rationale. Low blood pressure indicates shock. The priority is to restore circulation with 4 fluids. Strategy. Shock equals fluids first. Question 7. A client with COPD develops increasing shortness of breath. Which action is priority? A. Apply oxygen. B. Encourage coughing. C. Check temperature. D. Offer fluids. Correct answer. A. Apply oxygen. Rationale. Shortness of breath indicates breathing difficulty. Oxygen is priority. Strategy. Breathing problem equals oxygen first. Question 8. A nurse is caring for a client receiving blood transfusion. The client develops fever and chills. What is the nurse's priority action? A. Stop transfusion. B. Give antipyretics. C. Call provider. D. Monitor vitals. Correct answer. A. Stop transfusion. Rationale. Fever and chills indicate transfusion reaction. Stop transfusion immediately. Strategy. Blood reaction equals stop transfusion first. Question 9. A client with stroke suddenly develops difficulty swallowing. What is the nurse's priority action? A. Give thickened fluids. B. Keep client NPO. C. Sit client upright. D. Call speech therapist. Correct answer. B. Keep client NPO. Rationale. Difficulty swallowing increases aspiration risk. Prevent aspiration first. Strategy. Swallowing problem equals NPO first. Question 10. A nurse is caring for a client with asthma who is wheezing and anxious. What is the nurse's priority action? A. Give bronchodilator. B. Apply oxygen. C. Call provider. D. Check temperature. Correct answer. B. Apply oxygen. Rationale. Client is experiencing breathing difficulty. Oxygen is priority. Strategy. Airway and breathing always first. Question 11. A nurse is caring for a client with heart failure. Which finding requires immediate intervention? A. Weight gain of 1 pound. B. Crackles in lungs. C. Fatigue. D. Decreased appetite. Correct answer. B. Crackles in lungs. Rationale. Crackles indicate fluid in lungs and possible pulmonary edema, which is life-threatening. Strategy. Lungs equals priority. Always treat breathing problems first. Question 12. A client with postoperative abdominal surgery reports sudden severe pain. What is the nurse's priority action? A. Administer pain medication. B. Assess surgical site. C. Call provider. D. Reposition client. Correct answer. B. Assess surgical site. Rationale. Sudden pain may indicate internal bleeding or complications. Assess first. Strategy. Assess before action. Question 13. A nurse is caring for a client with hypoglycemia. Which symptom requires immediate treatment? A. Sweating. B. Confusion. C. Hunger. D. Headache. Correct answer. B. Confusion. Rationale. Confusion indicates severe hypoglycemia and requires immediate treatment. Strategy. Neurochanges equals priority. Question 14. A client with pneumonia develops oxygen saturation of 88%. What is the nurse's priority action? A. Apply oxygen. B. Encourage fluids. C. Check temperature. D. Give antibiotics. Correct answer. A. Apply oxygen. Rationale. Low oxygen saturation indicates hypoxia. Strategy. Low SpO2 equals oxygen first. Question 15. A nurse is caring for a client with burn injury. Which action is priority? A. Apply ointment. B. Start 4 fluids. C. Give pain medication. D. Cover burn. Correct answer. B. Start 4 fluids. Rationale. Burn clients lose large amounts of fluids leading to shock. Strategy. Burns equals fluids first. Question 16. A client with meningitis becomes drowsy. What is the nurse's priority action? A. Assess level of consciousness. B. Give antibiotics. C. Call provider. D. Reorient client. Correct answer. A. Assess level of consciousness. Rationale. Drowsiness may indicate increased intracranial pressure. Strategy. Neurochange equals assess immediately. Question 23. A nurse is caring for a client with hypovolemic shock. Which finding is priority? A. Tachycardia. B. Low urine output. C. Hypotension. D. Cool skin. Correct answer. C. Hypotension. Rationale. Hypotension indicates severe shock requiring immediate intervention. Strategy. Shock equals BP priority. Question 24. A client with asthma is using accessory muscles to breathe. What is the nurse's priority action? A. Administer bronchodilator. B. Apply oxygen. C. Encourage fluids. D. Call provider. Correct answer. B. Apply oxygen. Rationale. Accessory muscle use indicates respiratory distress. Strategy. Breathing difficulty equals oxygen first. Question 25. A nurse is caring for a client with new onset confusion. What is the nurse's priority action? A. Reorient client. B. Assess oxygen level. C. Call provider. D. Offer fluids. Correct answer. B. Assess oxygen level. Rationale. Confusion may indicate hypoxia. Strategy. Confusion equals check oxygen. Question 26. A client with diabetic ketoacidosis has blood glucose 550 mg per deciliter. What is the nurse's priority action? A. Administer insulin. B. Start 4 fluids. C. Call provider. D. Monitor urine output. Correct answer. B. Start 4 fluids. Rationale. DKA causes severe dehydration. Fluids are priority. Strategy. DKA equals fluids first, then insulin. Question 27. A nurse is caring for a client with seizure disorder. The client begins to seize. What is the priority action? A. Insert airway. B. Turn client to side. C. Hold client down. D. Give medication. Correct answer. B. Turn client to side. Rationale. Turning prevents aspiration. Strategy. Seizure equals safety first. Question 28. A client with heart failure reports shortness of breath while lying down. What is the nurse's priority action? A. Elevate head of bed. B. Call provider. C. Give fluids. D. Monitor vitals. Correct answer. A. Elevate head of bed. Rationale. Position improves breathing. Strategy. Position first for breathing. Question 29. A nurse is caring for a client with postoperative bleeding. What is the nurse's priority action? A. Reinforce dressing. B. Apply pressure. C. Call provider. D. Monitor vitals. Correct answer. B. Apply pressure. Rationale. Applying pressure helps stop bleeding immediately. Strategy. Bleeding equals stop bleeding first. Question 30. A client with hypocalcemia develops muscle spasms. What is the nurse's priority action? A. Give calcium. B. Call provider. C. Monitor vitals. D. Encourage fluids. Correct answer. A. Give calcium. Rationale. Hypocalcemia can cause tetany and airway compromise. Strategy. Low calcium equals give calcium immediately.